Good morning, good morning. Happy Monday. What's the date? 11th, ne? 11th. 11th of April. My daughter saying yes. Nana Kisa Meja Pai Kapo. Good morning, everyone. Hey, kids are special. Let's see if we can remind leaders. Good morning, great leaders. Am I audible? Okay. I am audible. Good morning, great leaders. Let's wait a minute or two. Let us please share this the link of this training with our many respective partners worldwide. Hey, let me just put down this volume now. Now it's making an echo. Good morning, everyone. Thank you, Nana. Let's please say hello. Let us see who's here. Good morning, Dida Muzi. My partner in crime, tuning in from Eswatini. Let's see, Kozi saying hi. Hi, Kozi. My leaders, let's just please send this training to our respective partners. I am now live. I'm telling Kozi now. Good morning, everyone phew, on this beautiful but cold Monday. Hmm? No, I'm okay, Nana. Let's just please invite our yeah, leader. Sorry, network is bad. I mean, it was raining all weekend, all day today. So yeah, I was battling to log on, but thankfully it was not as bad as last week. Last week took the cup. Sorry, last week took the cup. Let's just share, invite our prospects and everyone else. Good morning, Sir Richard. Good morning, good morning. As usual, we're going to have our pens, right? We're going to have our pens because there's certain things that I'm going to say that might not be in the training that I am going to send today. And we have our right, our long wish book or whichever book you use. And we have our alkaline backup. There is a lot of information I'm going to divulge and I'm going to share with you. Welcome, Coach Z. I've been talking about it that you're checking if I'm alive and well. No, alive and kicking, but yeah, weather. Wi-Fi is dependent on the weather. So, my leaders, today we will be discussing blood disorders on this beautiful day. And I want to know from you: do you know of anyone that has a blood disorder, and what is it? You can just say the name of the blood disorder. Let's engage. Let's engage. Do you know of anyone with a blood disorder? Let us engage. Let us engage. Yeah. Hi, Honalina. Onalina. Hello. Good morning. Good morning. Good morning, my angel. Do you know of anyone that has a blood disorder? And then what is? Do you know what's the name of the blood disorder? Let us engage, great leaders. Yeah, there's a lot to talk about. And like I said, please have your pen and please have your journal wherever you write, as this is training. We're going to talk a lot because we all have blood, right? Welcome, Leader Yemi. Welcome, leadership. Let us engage, great leaders. Do you know of anyone with a certain blood disorder? While I am waiting for you to answer, let me just check on the training quickly. Okay, let me just open this up. Then I am going to share the screen with you just now. Okay, let me just fix on this. I do apologize, but yeah, there's nothing we can do with weather and stuff like that. But I'm so grateful that it's better than last week. Last week was just a nightmare. Yeah, last week. Let's just check. I'm just opening up the training. Okay. Welcome, Leader Lafon. Welcome, leadership. All right, I asked the leaders who just came in. Do you know of anyone with any blood disorder? Hopefully, you know somebody that you might maybe be able to assist today. So let me just share the screen with you quickly and let us begin with training. Okay, since you know the Wi-Fi is slow, ne? So now I am waiting. So I'm do it like this. Okay. Yes, we got it. See? Yeah. Yes, we got it. StreamYard. Yes, we got it. So we are discussing, ladies and gentlemen, for the ladies and gentlemen that do not know my name is Pulane. I am your long reach product specialist. Welcome to the Health Hub Show. Today we are discussing blood disorders. I think this is a topic that everyone should actually be interested in, as everyone has got blood in them. Now let's begin. What is blood? Let's start there. So your blood is living tissue made up of liquid and solid. Let me just put this down. The liquid part is called plasma, is made up of water, salts, and protein. Over half of your blood is plasma. The solid part of your blood contains red blood cells, white blood cells, and something called platelets. Blood disorders, I hope you can see, right? Let me see. Hey, can I zoom this thing in? Hey, you see, I forgot to convert it to PDF, but it's fine. I think you can see, right? Please confirm that you can see the screen. On my side, it looks like you can see it. Blood disorders affect one or more parts of the blood and prevent your blood from doing its job. They can be acute or chronic, so not so serious and very serious. Many blood disorders are inherited. Please write that down. Many blood disorders are inherited. Other causes include other diseases, side effects of medicines, and a lack of certain nutrients in your diet. We're going back to diet, lifestyle. So, types of blood disorders include the following: platelet disorders, excessive clotting, and bleeding problems, which affect how your blood clots. Then, anemia, which happens when your blood does not carry enough oxygen to the rest of your body. And then we have cancers of the blood, such as leukemia and myeloma, and what? Hey, you know English, especially medical English. Eosinophilic disorders, which are problems with one type of white blood cell. Eosinophilic disorder, I will explain it a little bit later, which is like right now. So eosinophils are a type of white blood cell. They help fight off infections and play a role in your body's immune response. They can also build up and cause inflammation. Welcome, Coach H. Sorry, ladies and gents, my throat is a bit scratchy. Normally, your blood doesn't have a large number of eosinophils. Your body may produce more of them in response to the following: allergic disorders, skin conditions, parasitic and fungal infections, autoimmune diseases, some cancers, and bone marrow disorders. In some conditions, the eosinophils can move outside the bloodstream and build up in organs and tissues. This can happen in many different parts of the body, including the esophagus. So here, esophagus, right? Where your foods, your liquids, everything that goes in the mouth has to pass through your esophagus, your heart, your lungs, your blood, and intestines. Treatment of eosinophilic disorders can vary depending on the cause and which part of the body is affected. Steroids are often part of the treatment. Remember, it causes what? Inflammation. And normally they give us steroids to treat inflammation. Now, what are the symptoms of blood disorders? Blood disorders can cause various symptoms in almost any area of the body. Most commonly, symptoms are caused by decreases in the blood component. Right, I'm going to name a couple of them. So, decreased red blood cells and hemoglobin can cause symptoms of anemia, such as fatigue, weakness, and shortness of breath. Okay, so, right? Right, next, decreased white blood cells or immune system proteins can cause recurrent fever and infections. And then decreased platelets or blood clotting factors can cause abnormal bleeding and bruising. And then occasionally, symptoms may relate to increases in blood components. Remember, we said when we started, we said blood is mainly more than half of it is made of plasma, and then the rest is red blood cells. And then increased red blood cells, also known as erythrocytosis, can cause thickening of the blood, also known as increased blood viscosity, and thereby cause headaches and a red complexion, a plethora. So you you look like you are blushing when you're actually not. And then increased immune system proteins also can cause thickening of the blood, which is also known as increased blood viscosity. And then increased platelets or blood clotting factors can cause inappropriate excessive blood clotting, known as thrombosis. And then when blood disorders cause a person's blood to become thickened, the thickened or more viscous blood may have difficulty passing through small blood vessels. Remember now, it's thicker than usual, decreasing blood flow to certain areas of the body, which is a serious condition called hyperviscosity syndrome. Affected people may experience symptoms such as shortness of breath, headaches, dizziness, and confusion. Hyperviscosity syndrome can occur in people who have multiple myeloma, in which it is caused by increased immune system proteins. I hope we're together, my leaders, right? Continue. Blood disorders often cause symptoms that can also occur in other disorders. Ish. For example, the weakness and shortness of breath caused by anemia can be caused by other conditions that impair oxygen delivery to your body, such as heart or lung disorders. Also, easy bruising, a symptom suggestive of a blood disorder, can be caused by other conditions such as disorders of the blood vessels or the use of various drugs such as aspirin. Welcome, Leader Nkululeko. Welcome, welcome, all the way from Zim. Welcome, leadership. Blood in the urine or stool, stool meaning your number two, can be caused by a blood disorder, but is usually caused by an abnormality in the urinary or gastrointestinal tract. Although people may have bleeding after an injury or a medical procedure, such as dental procedures, or during menstruation, the presence of some blood disorders makes such bleeding worse. Some symptoms are more suggestive of a blood disorder. Just a few examples include the following. So blood clot. Let's start there. So, what is a blood clot? Where does it occur? It's usually in the leg, most often causing swelling, redness, and or warmth of the leg or shortness of breath. Then there's something called petechia. It's a fine pinpoint red skin rash caused by too few platelets. Now, if you look at the screen on the top right of the page, that is the petechia. All right. Then there's blood blisters in the mouth caused by too few platelets or clotting problems. Imagine that blood blisters in your mouth. Swollen lymph nodes. For the leaders that have been following the training, I've spoken extensively about lymph nodes, right? Earlier on, a few weeks back. Swollen lymph nodes caused by white blood cell cancers such as leukemias or lymphomas. And then something called pallor or pale skin caused by anemia. And then pica, which suggests an iron deficiency anemia. People with this kind of anemia are forever eating ice, dirt, or clay. Even I used to have this growing up. Then this wonderful, wonderful, well, I shouldn't actually say wonderful, but this is a disease one of our leaders asked me about a few weeks ago. So I included it as well. Sickle cell disease. I remember she said sickles for the leaders that remember. It's an inherited blood disorder where red blood cells become sickle or crescent shaped. It causes frequent infections, swelling in the hands and legs, pain, severe tiredness, and delayed growth or puberty. Welcome, Lida Mpilo. Welcome, Lida Rosari. So, like I said, for the leaders that just joined, I said earlier on, before this, I said it's please write that it's normally inherited. Blood disorders are normally inherited. I'm just trying to find that place now. You see now I'm looking for it and then I cannot find it. Oh my word. Okay. Okay. No. And now I don't remember where it was. It's supposed to be here. Yeah, now I'm looking for it and I know it's here because I did speak about it. Yeah, the blood disorders are normally predominantly inherited. I wanted to show the details that just came in. So we were here, right? And this was part of some examples of blood disorders, which are the blood clots, right? The petechia, which is the top right picture, blood blisters in the mouth, swollen lymph nodes, pale skin, pica, which is another form of anemia, which is of iron deficiency, and then sickle cell disease. I hope it's together, right, leaders? And then blood clots. What is a blood clot? It is a mass of blood that forms when platelets, proteins, and cells in the blood stick together. When you get hurt, your body forms a blood clot to stop your bleeding. After the bleeding stops and healing takes place, your body usually breaks down and removes the blood clot. But sometimes the blood clots form where they shouldn't. Your body makes too many blood clots or abnormal blood clots, or the blood clots don't break down like they should. These blood clots can be dangerous and may cause other health problems. Blood clots can form in or travel to the blood vessels in the limbs, the lungs, the brain, the heart, and kidneys. The types of problems blood clots can cause will depend on where they are. Here are some of them. I've spoken before about deep vein thrombosis sometime last year, I think it was October, if not November. DVT, deep vein thrombosis, is a blood clot in a deep vein, usually in the lower leg, thigh, or pelvis. It can block a vein and cause damage to your leg. Remember, it it prevents blood flow. It impedes circulation. A pulmonary embolism can happen when a deep vein thrombosis breaks off and travels through the bloodstream to your lungs. It can damage your lungs and prevent your other organs from getting enough oxygen. Then cerebral venous sinus thrombosis, also known as CVST, is a rare blood clot in the venous sinuses in your brain. Normally, the venous sinuses drain blood from your brain. Then CVST blocks the blood from draining and can cause a hemorrhagic stroke. And then lastly, blood clots in other parts of the body can cause problems such as ischemic stroke, a heart attack, kidney problems, kidney failure, and pregnancy related problems. There are some ladies who also develop DVT due to pregnancy. All right. Who is at risk for blood clots? My leaders, are you learning? Who is at risk for blood clots? Certain factors can raise the risk of blood clots, which are atherosclerosis, all right, buildup of plaque in your arteries, all right, that's one of the easiest explanations of atherosclerosis. Atherosclerosis can also lead to heart attacks, and then atrial fibrillation. I'm going to explain that a little bit now. Cancer and cancer treatments are also some risk factors of blood clotting. Yeah, thank you, Onalina. Thank you so much, my angel, for opening up. Certain genetic disorders as well can be a risk factor of blood clots. Certain surgeries COVID-19, I think all of us know this about COVID-19, diabetes, family history of blood clotting, overweight and obesity, pregnancy and giving birth, serious injuries, some medicines that also include birth control pills. All right. Smoking, ladies and gentlemen, is also a risk factor for blood clots, and staying in one position for a long time, such as being in the hospital or taking a long car or plane ride, or even a bus ride, even a taxi ride, especially in South Africa. So those are the people who are at risk for developing blood clots. Now, symptoms of blood clots. Um, the symptoms for blood clots can be different depending on where the blood clot is. Right. First one in the abdomen. Good morning, our SD4. Welcome, SD4. In your abdomen, you can experience abdominal pain, nausea, or vomiting, or vomiting. In your arm or leg, you have sudden or gradual pain, swelling, tenderness, and warmth. My leaders, these are our day-to-day clients. In your lungs, you can have shortness of breath, pain with deep breathing. So when you go, you're like, oh, what was that? When you take deep breath, then you have unexplained pain. And then rapid breathing and increased heart rate. So you can think maybe you're having a panic attack, it's something far worse. And then in your brain, trouble speaking, vision problems, seizures, even weakness on one side of the body, and sudden severe headache. Remember, we spoke about brain hemorrhaging just now. So think about strokes. All right. And then in the heart, you're going to have chest pains. All right. So like angina, sweating, shortness of breath, and pain in the left arm, specifically left arm. All right. And then how are blood clots diagnosed? Your healthcare provider may use many tools to diagnose blood clots. These are some of the ways: a physical examination, a medical history. Remember, some of them are familial. Blood tests, including something called a D-dimer test, imaging tests such as ultrasound, X-rays, and a CT scan. I hope you're learning, my great leaders. And then remember, I spoke about atrial fibrillation, and I said I'm going to explain it a little bit later. This is the time. Now, an arrhythmia is a problem with the speed or rhythm of the heartbeat. Atrial fibrillation, also known as AF, is the most common type of arrhythmia. The cause is a disorder in the heart's electrical system. Often, people who have AF may not even feel symptoms, so asymptomatic. But you may feel the following: palpitations, which is an abnormal rapid heartbeat, shortness of breath, weakness or difficulty exercising. There are some people that when they exercise, I know of one gentleman, when he jogs, he cannot even jog a kilometer, he just passes out. All right. And he's young, he's just 29. Chest pains, dizziness or fainting, fatigue, confusion, even. AF can lead to an increased risk of stroke. In many patients, it can also cause chest pain, heart attack, or heart failures. Doctors diagnose AF using family and medical history, a physical exam, and a test called an electrocardiogram, EKG, which looks at the electrical waves your heart makes. Treatments may include medicines and procedures to restore normal rhythm. Bleeding disorders, like I just wanted to, this training is not too much, but I'm just giving you an awareness that we actually have these customers on a day-to-day basis. So normally if you get hurt, your body forms a blood clot to stop the bleeding. For your blood to clot, your body needs cells called platelets and proteins known as clotting factors. If you have a bleeding disorder, you either do not have enough platelets or clotting factors, or they don't work the way they should. Bleeding disorders can be a result of other diseases such as severe liver disease or a lack of vitamin K. They can also be inherited. Haemophilia is an inherited bleeding disorder. Bleeding disorders can also be a side effect of medicines such as blood thinners. Various blood tests can check for a bleeding disorder. You will also have a physical exam and history. Treatments depend on the cause. They may include medicines and transfusions of blood, platelets, or clotting factor. Ladies and gentlemen, on April the 17th, which is on Sunday, Palm Sunday, it is World Hemophilia Day. Now, because World Hemophilia Day is soon, I just want to share this video with all of you. I hope we're learning, right?
Today's topic is hemophilia. Hemophilia is a genetic disorder that affects the body's
Can you hear?
ability to clot due to the lack of or low level of certain
Okay.
protein called the clotting factors. There are 13 types of clotting factor, which works with the platelets to stop bleeding at the site of an injury. This means that after an injury, the person bleeds for a longer time than they would if their blood clotted normally. Hemophilia can also result in internal bleeding in the knees, ankles, and elbows, which can damage organs and tissues and may have life-threatening complications. This bleeding can be seriously devastating if it occurs within the brain, as it results in headaches, seizures, or a decreased level of consciousness. Hemophilia is more prevalent in males. According to the World Federation of Hemophilia, about 1 in 10,000 people are born with this condition. There are two main types of hemophilia: hemophilia A and hemophilia B. Hemophilia A is the most common type, and it occurs as a result of a deficiency in clotting factor 8. Hemophilia B occurs as a result of a deficiency in clotting factor 9. It is also called Christmas disease. Other types of hemophilia, which result from a deficiency in clotting factor 11, and parahemophilia that is due to a deficiency in clotting factor 5. In very rare cases, hemophilia can develop after birth, and this is called acquired hemophilia. It is associated with cancers, autoimmune disorders, and pregnancy. Causes: hemophilia is an inherited disorder that is caused by a defect in the gene located on the X chromosome that determines how the body makes clotting factors 8, 9, or 11. Everyone inherits two sex chromosomes, one from each parent. Females inherit two X chromosomes, one from each parent, and males have an X chromosome from the mother and Y chromosome from the father. Because the genetic defect that causes hemophilia is located on the X chromosome, it is passed down from the mother to the son through the mother's gene. This is to say, a male that gets the X chromosome with the altered gene from his mother will have the disorder. Males, unlike the females, lack a second X chromosome, and so are unable to make up for the defective gene. A female that has the altered gene on one of her X chromosomes is a carrier. She doesn't have the disease herself, but may pass it on to her children. For a female to have the disorder, she must have the altered gene on both of her X chromosomes. However, this is very rare. Symptoms: the level of clotting factors determines the severity of symptoms. They include many large bruises, blood in urine or stools, excessive and unexplained bleeding from cuts or injuries, or after surgery or dental work, unusual bleeding after vaccinations, unusual nosebleed without a known cause, pain or swelling around the joint. Symptoms of brain bleeding may include lethargy, paralysis, seizures, headaches, vomiting, double vision, sudden weakness or clumsiness. Diagnosis and treatment: medical history and blood tests are key to diagnosis. On suspicion, the physician will ask about family history and medical history to help with identifying the cause. A blood test may give information about the level of clotting factors, which clotting factor is missing, and the time it takes for the blood to clot. Pregnant women who are carriers may have their fetus tested for the condition after 10 weeks of pregnancy. Treatment: the main treatment is replacement therapy. This therapy focuses on receiving a replacement of the specific clotting factor that is missing and is given intravenously. The treatment can be derived from human blood or synthetically produced in a lab. Synthetically produced factors are called recombinant clotting factor and are considered the treatment of choice as they reduce the risk of transmitting infection carried in the human being. Other treatment may include desmopressin, antifibrinolytics, fibrin sealants, and physical therapy. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
Now, where is it now? Okay, let me do this. Partners, now why is this thing giving me so many problems today? Leaders, are we together? Did we learn something? I'm not sure why today it's doing this. I'm not really sure. Why is it doing this? Well, since it's doing that, so now we know, I hope, what hemophilia is. It's a rare disorder uh, in which the blood does not clot normally, and it is usually inherited. Remember what I said earlier on about that? All right, I see. Now, my leaders, I'm trying. I'm not sure why this is happening now. I'm trying to get back to all of you, and then yes, sir, Richard, it's very, very interesting. Now, if I can just get this thing to work now, I'm not sure what's happening. Oh, I'm being sabotaged, leaders. I'm being sabotaged. Okay, I hope now this works. Okay, let me do this. There is another way to do this. So I'll just be smart about it. Let me just see if I can find it. I'm not too sure why this always happens here. But I can see, you can see my screen, so it's fine. I'll just go on to, because the screen that I wanted to share is actually here. Okay, let me just go on to my long reach. Now, which long reach product can we recommend? Remember, this is people who have uh, blood disorders have to see their health practitioner. Number one, never, ever, ever tell anyone that they shouldn't see the health practitioner. Okay, now I am with you guys. So this is all that I actually needed to do. Okay, now I know. Okay, so my leaders, these are the recommended language products. Um, anyone that has a blood disorder, all right, yes, they should still be on their prescribed medication. Yes, and they can also still take a long reach product. So obviously, number one, the long reach alkaline packup, that goes without saying, right? Number two, okay, when it comes to the alkaline packup, my leaders, um, remember they spoke about oxygen, not they spoke about thickening of the blood. So luckily, our long reach alkaline packup also regulates blood viscosity. All right, so it regulates your blood viscosity, your blood pressure. So that's why you also need the alkaline packup. The other reason for the alkaline packup is that it breaks down. Remember, it breaks down the water molecules so that they reach the cells far quicker than if it was just normal tap water or normal bottled water. All right. And because of the anion and the tourmaline gemstones that break down the water. Then our cordyceps coffee, it has vitamin K. Remember, with some clotting factors, they spoke about vitamin K. Our cordyceps coffee has vitamin K and all other beautiful, delicious vitamins. All right. Yes, on Alena, cordyceps capsules, if not on blood thinners already. Yes, cordyceps capsules. I didn't include it at all for this because this is a very dangerous, or should I say, a very sensitive topic regarding blood. So it's not even included here. The cordyceps capsules is a no-no because normally people with blood conditions, heart conditions, are on some form of blood thinner. So I did not include this at all. Now the other product, third product, is the sea buckthorn berry oil. It helps as well with blood formation. It prevents blood platelets from clumping and reduces bad cholesterol. That's the other cause of atherosclerosis. Also, it's cholesterol, not just buildup of plaque. PLAQUE. Also, cholesterol. All right. And then the other product is our green tea. Also, the brown tea specifically for anemic patients, low blood patients. Okay, so the green tea is also very good as it also promotes oxygen in the blood. All right, and then we have our calcium tablets. Our calcium tablets, it helps in the formation of hemoglobin. If you are paying attention, we spoke about hemoglobin because without hemoglobin, you basically die. You basically die. All right? Who would have thought? Calcium. Calcium also helps with the nerve signals. If you remember, we spoke about the electrical waves of your heart. So that's also a selling factor for someone with a certain blood disorder. And then our NutriV Blue Shake, this one is a no-brainer. It's got over 40 fruits and vegetables, and those 40 fruits and vegetables are jam-packed with all the nutrients that we do need to help with like the greens, it helps with the vitamins that we need for proper blood formation, for blood regulation, and so many other things. Let's see, the last one. In closing, well, almost. The worldwide incidence of hemophilia is not well known, but sufferers are estimated at more than 400,000. In South Africa, 1 in 5,000 boys are born with hemophilia. Remember, hemophilia is predominantly in males. It affects people of all races and ethnic origins globally. So it doesn't matter how rich you are, how not educated or educated you are, you also, yeah, the plane is field. The field is plain. Yeah. Regrettably, though, a vast number of patients with hemophilia or other bleeding disorders remain undiagnosed or are diagnosed at a very later stage. Unfortunately, approximately 75% of people with hemophilia around the world still receive inadequate treatment or have no access to treatment. Now, back to this training that we're doing, right? When I explained, we said the product, alkaline backup, it's got anion, tourmaline gemstones, calcium chewable tablet. It helps with production of hemoglobin, NutriV Blue Shake because of that, over 40 fruits and vegetables, and then Arthrosub Reviver. I knew I forgot something. Arthrosub Reviver, it helps with erythropoietin, sea buckthorn berry oil. Don't worry, I'm going to explain these terms just now. Sea buckthorn berry oil, it helps with DNA support and repair and also regulates blood platelet. Green or brown tea, it increases supply of oxygen in the blood. And cordyceps coffee for those who have the clotting factor that needs vitamin K. Now, some definitions. Hemoglobin, oh, sorry for that. Hemoglobin is a protein molecule found in the red blood cells. also known as erythrocyte, that carries oxygen from the lungs to the rest of your body. Without hemoglobin, your red blood cells cannot deliver the oxygen that your cells need to produce energy. Hemoglobin is vital for human life. Now, erythropoietin, that is a hormone secreted by the kidneys that increases the rate of production of red blood cells in response to falling levels of oxygen in the tissues. Where do we get this? From our arthros subdiviva and yes, our berry oil. And then anion, for the leaders that do not know, it's negatively charged ion. It's beneficial to the human body. It's also known as the human security or bodyguard. And then at the end, ladies and gents, I always said, like I said just now, even in the trainings, please seek guidance and consult with your health practitioner, even if you are using language products. Remember, safety first. Now, as of tomorrow, my leaders, as of tomorrow, you can email me on the health hub at longreachsa.co.za from tomorrow. If it's bouncing, just I encourage you to email me after like 3 p.m. The health hub at longreach /sa.co.za. Ladies and gentlemen, that is all for today. Are there any questions? I hope I was not too fast. I really hope I was not too fast. My leaders, did we learn something today? Do you see that we have so many customers that are just waiting for you and me? And then the other thing that I actually forgot to put in the notes, but I will mention now, I asked you most to have your pins. Um, for For hemophilia, there's normally three dangers, okay, my leaders. There's something called hematoma. What I'll do, I'll just add it onto the PDF now. Well, the PPT before I convert it to PDF, and then I'll send it to SD Verve, and then she will share it in the rest of the groups because I'm still not in the groups. I do have a phone now, but I don't want to get into the groups because it's a temporary phone, you know. So there's something called hematoma. So for people who are suffering from hemophilia, these are some of the dangers. Hematoma is a buildup of blood under the skin, all right? And then there's something called hemathrossis. Hemathrossis, that is blood that spills into your joints. So you can't even do this, you know. So that's hemathrossis, and then hemorrhage. We spoke about it. That's internal bleeding into the organs or your brain. It can cause headaches, seizures, decreased level of consciousness, even. So that's the dangers of people that are suffering from hemophilia. Those are the three main dangers that they three main dangers that they need to be aware of on a day-to-day basis. My leaders, this was quite an exciting training, even for myself. Um, Leader Rosari, remember it. I think you joined after I did this. It depends on what kind of uh, uh, blood disorder they have. So it depends on what kind of blood disorder they have. Like I said, I was very specific when I said with anemia, with low blood, né, with low blood. Uh, I said it's normally the brown tea is a winner over the green tea. So these are the things that you need to know. These are the things that I actually teach you in the Product Specialist Academy, which is going to start soon, you know. So these are the things that unfortunately, I cannot get too deep in them here because of time. But yes, if it's, let's say, yeah, low blood, you can recommend the brown tea and the berry oil. Okay, so it actually depends what kind of blood disorder they have. then you'll know that, okay, for this one, remember I even said there's a bleeding disorder where that uh, needs a vitamin K, clotting factor, it needs a vitamin K. Then you know that you recommend um, our cordyceps coffee, because it's got vitamin K. So it all depends on what type of blood disorder they have. Then you know which product to will best suit them. Which product would you recommend to best suit their condition. So it's not all of them. Oh my word, no. But we all need the alkaline pickup without a doubt. We all need the alkaline pickup. So my leaders, remember we don't take our long reach products along with our prescribed medication. We have to allow for at least 1 hour. Oh, I'm tired. I see even my eyes are brown. Oh, I'm so tired today. Lila Rosario, you asked this question last week and I said no. And you see, that's the thing. I remember everything that everyone asked. You cannot drink snake oil under any circumstance. Lida Rosari, that's why you need your book. That's why you need your notebook so that you can write all of these things. Because the brain is not always reliable, especially when it comes to memory. Yes, Lida Nkulako, alkaline pickup is absolutely the best. So my leaders, do you have any other more questions? Do we have any more other questions? And remember, I said we now have an email address for the Health Hub. You can email me from tomorrow, 3 o'clock. Normally, my service provider is very fast, but just to be safe, if it bounces, I'm just saying, if it bounces, don't be alarmed. But from tomorrow, 3 o'clock, the email I will be working, and and the other thing is, when you email me like your suggestions, your suggestions on the topics you would love for me to touch on, or a product that you would love me to touch on. But what I do a holistic training. When I train on a product, I also link it with health, all right, with health and wellness, because I can't just be talking about brown tea and then be too specific and not tell you what uh, health condition um, you can recommend the brown tea for. We need to make it a holistic training. My leaders, are we all okay now? Oh, Leader Nkuleko. Okay, let me print it for you. The new email for the show is the health. Hey, now I can't type the health. The health hub. Here is the health hub at Longreach. sa.co.za. Yeah, the health hub at Longreach sa.co.za. So you can send through, like I said, your requests on what product or what uh, health issue you want me to touch on. And if I have touched on that health issue, I will just send you the link of the training or the date of the training. Remember, in January, in January, I took out the lesson plan um, where I gave the dates of the trainings. Let me actually show you. Didankulileko. Hey, Coach Z, you still here, my angel? Let me just show you because I actually forgot to share this on the Health Hub. Let me just show you my leaders. Let me just show you what the lesson plan looks like. Um, here it is. So a few months from now, I think I forgot. I don't think I've ever shared this here, but I shared it on my Facebook though. But actually, I should actually share it here as well because I mean, it is the show. Okay, so this is what training looks like. The past couple of trainings, the first since I began the show, which began on the 26th of July, 2021, and I said clockwise from July. Sorry, guys, I'm left. My brain works this way. You know, left people we work. So this is what it looks like. I'm trying to zoom in here. Ne? Okay, okay. I think I zoomed too much. Ooh, that was too much. I don't know how to. You see, we myself and Coach Z we installed new Windows programs, so we trying to roll with the punches. I'm also seeing it on. Okay, so my leaders, if there's a leader who will send in a suggestion of a disorder that I have touched on, I will send you the lesson plan. I did breastfeeding last year, August, women products and lifestyle diseases, oral health. I've actually touched on. Hey Z, it was so stressful this Windows 11. Eating habits. You know, September I did kidneys, ADHD, eye health, and the heart. So yeah, this is the lesson plan that I did. So this lesson plan ends in December 2021. So in July 2022, uh, the same lesson plan will come through, but of January, February, March, April, May, June. Okay, so that we are all together. See, I've also touched on fibroids. A lot of leaders still ask on fibroids. I did it on the 8th of November. I also did, you see, deep vein thrombosis. I did it in December. I did veins on the 6th of December. And I also spoke about sanitizers. Why long reach sanitizers are needed right now. So, my leaders, yeah, we really go above and beyond. Please attend previous trainings. Please, please, please. I'm pleading for myself and Coach Z class, Summer, because we're a team. Now you see it's starting. So now I must do this. Now it wants me to do this. I don't understand this thing. Let me just go here so that it takes me back to you. I Coach Z, we really suffer here. Okay. So my leaders, that is all for today. I see there's no more questions. We'll meet again next week. Um, Next week's training is, I think it's next week. Next week or the week after, we are going to do an FAQ session. It should be very interesting because I will have a guest. So the long reach frequently asked questions regarding health and wellness and products, where we're going to we just need to do that show, okay? Long reach FAQ. So I'll be doing it with one of my esteemed product specialists, and then yeah, we'll take it from there. So my leaders, we've now gone 53 minutes. I see there's no more questions. Remember I said I'm going to just amend this PPT quickly, convert it to PDF, and then send it to SDViv, and then she will share it with the groups, and everyone can share it with everyone else. So my leaders, what I know for next week, besides the FAQs, we will also be discussing irritable bowel syndrome, IBS, irritable bowel syndrome, and then we'll also have a long reach FAQ regarding health and wellness and our products. Thank you so much, my leaders. Are we excited? Did you learn something new? Am I giving you the clients? Because we meet people each and every day, and then we are like, hey, but this person, why is this person bruising all the time? Now we know. There's another term, but I won't say it now, for bruising easily. Yeah, that one also needs our arthro reviver, but I will touch on it a little bit later. So my leaders, are we all sorted? Can we call it a night? There's still a couple of minutes left before it's 1 hour, but can we call it a night? That I amend this PPT quickly, and then I send it to our SD. Okay, thank you so much, leader Tozama. Thank you so much, my angel. Thank you so much, my leaders. So yeah, luckily, so now I just thought I don't know why I never thought of this before. And it helped that the phone crashed, right? That why don't I have a dedicated the one named after the health hub? I think that's actually even more better, much better. So my leaders, thank you so much for spending your almost 1 hour with me. I do appreciate, I do love and respect all of you. I'll meet you next week Monday, right? 7 o'clock with one of my special guests. Leader Peter, Kozi, can you answer that one? Leader Peter is asking about prices. Me, I don't do prices. Leaders, PS Pulane never does prices. Okay. Leader Mkolako, oh, my leaders, please, if you don't get the PDF tonight or tomorrow morning, please feel free to inbox me or send me the email. Okay, but remember, you send me the email tomorrow after 3 p.m. South African CET. Okay. Yes, Leader Peter, please keep to the memo. The memo is the health hub. We don't do prices here. We don't do prices. Thank you, Osria. Thank you so much. I didn't even see you come in. Thank you so much, my leaders. We'll meet up next week where we're discussing irritable bowel syndrome and we're going to have an FAQ session. Thank you so much, my great leaders. Mwah! Love you.